Hi guys, I'm Dr. Priya Jayan. I'm an internal medicine attending. I'm a hospitalist here in the Bay Area. So it's 7 a.m. and I'm driving to the hospital for my rounding shift. Rounding shifts are from 7 a.m. to 7 p.m. And this is basically seeing patients who have been admitted either overnight or yesterday or who've been in the hospital for a few days. An admitted shift is primarily just us admitting patients from the ED. So here we go. So I just arrived, and now what I'll be doing is printing out my list for the day and pre-rounding on all my patients. So on average, I have about 14 to 16 patients that I round on. And in the pre-rounding process, I basically look at their vital signs, their lab abnormalities, anything overnight, basically improvement in the things that we were treating them for. And if there's any sort of specialist that I need to get involved, I usually like to call them in the morning so they have a good heads up and they can come and see them in the morning, just to get the ball rolling. After about an hour and a half of rounding, I will go upstairs to do a interdisciplinary round with the social worker, the case manager, the nurse, and the charge nurse and the pharmacist. So it's about 12:30 right now, and I'm taking a little break to have some lunch. This is definitely different from residency life, where you literally had 5 minutes in front of a computer to scarf down your food. So now I get to enjoy being outside in our cafeteria and take a little bit of a break and sunshine, and I'll get back to rounding again. I just finished doing the interdisciplinary rounds, and then I rounded with each of the patient, did a thorough physical examination, spoke with the family, spoke with the patient about the diagnosis and the treatment. I also touched base with all the consultants, and then I'll be right now pretty much writing my notes and following up on the labs and the treatment plans that we had and how the patient is recovering. The range of diseases that we see is quite varied in internal medicine, which is why I love it. I have a patient who has CHF exacerbation, so we're diuresing them with IV Lasix. I had a COPD exacerbation secondary to the flu. I also had a patient with AFib with RVR, so I consulted cardiology, and we have him on an amiodarone drip, and a stroke patient for which neurology is following as well, and then a DKA patient as well. We'll just be following up to see how they're doing today, following up the results and writing my notes. Hey guys, so it's about 7:30 now. I just finished my rounding shift. It was a fairly busy day. I feel like during the winter months, people get a lot sicker, and so the hospital is a lot more full. So internal medicine and primarily hospitalist because one, I like the acuity of diseases that we see in the hospital setting, and two, because of the pathology of the wide variety of things that we get to see also. I also like more of that collaborative teamwork with the other specialists, and I get to learn from them as well as I'm kind of expanding my own practice. And while I'm not necessarily a specialist in one field, I get to learn a little bit about every field and kind of expand my knowledge of that. I still use UpToDate, and I still use a lot of my medicine books to go back to my pathology and my basics. So as a hospitalist and an attending, I think what was different from what I expected was not so much the disease and the pathology. I think medicine and residency trains you well for that, but more of that social aspect of things. My day really consists of a lot of phone calls from nursing, from case manager, from social worker, from patient family, and in planning of their disposition. So basically, where are they going to go after being treated? So, treating patients is one thing, but then it's figuring out where can they go after the hospital, whether it's a skilled nursing facility because they need more physical therapy, or they need, other additional help, or whether it's in a board-in care, or whether it's going home, and do they have 24-hour care at home? How does it work in terms of their insurance? So a lot of that aspect, you don't realize that you're going to have to deal with when you're in pre-med or in medical school, but that's definitely a big portion of it. The path that I took, I was in UCLA undergrad. I did neuroscience as my major. And afterwards, I applied to a lot of US med schools and I didn't get in. So then I decided to go to the Caribbean AUC Medical School in St. Martin. And while initially I was a little bit nervous what that would be like in terms of my career moving forward and what specialties I would be able to get into, I absolutely loved my decision. I loved the medical school. I think, the medicine that we learned was in par with anything that we would learn here. It made me work harder because I felt like I had to prove myself. In terms of finding a residency, I was looking for one in California, and there are a few spots that definitely accept Caribbean graduates. And so that's gotten a lot easier because I think a lot of people go to the Caribbean now, so it's well known. And the residency that I trained in Santa Barbara was wonderful. I think I got some of the best attendings and education and experience. And now I'm attending in San Francisco as a hospitalist. So for me, it was a great decision. I wouldn't take that back at all. So, medicine, while it is you have to be very hardworking and dedicated and passionate about what you do, it also does take a lot of sacrifice. And I think that in order to prevent yourself from being burnt out in medicine, it's important to create that balance in your life, with family life, with your own diet and exercise, being mindful, yoga, meditation, all of those things can help you and ultimately help you to better take care of patients. So I think that's key.